Good evening, my name is Mr. Hood. I'm here to do my head-to-toe assessment for my health span class. I have my patient, Jason Ojeda, and we'll begin the assessment. The first thing I do, or I did before I came in, I wash my hands thoroughly to make sure we use all body substance isolations that we need to, and it's basically an aseptic exam. I'll demonstrate most procedures. Some things I'll talk through. Things we won't check on this exam are breast and genitalia, per the directions for our instructor. So now we'll come into the room. Good afternoon, Mr. Ojeda. You know why you're here today?
Yes, sir.
You're going to have a head-to-toe assessment.
Yes, sir.
Before I begin, are you hurting anywhere?
No.
You're in relatively good health.
Mm-hmm.
Just so you know, I've washed my hands and I'll use an aseptic technique in our examination. So the first thing I'm going to do is check vital signs. And we'll start with your blood pressure, then we'll take your pulse, and we'll take your temperature and your respiration. So let's just take a blood pressure. Okay, 118/78. Check your pulse. At the same time I'm checking your pulse, I can also get your skin temperature, color, see if there's any tinting. All looks normal. Pulse is 78. That's good, it's all within normal limits. And I'll get your respiratory rate. A couple ways I can do it. I'm just going to listen to you. Breathe. Just breathe normal. All right, 16 breaths per minute, and we checked your temperature already, okay?
Mm-hmm.
All right, so now I'm going to move on to the actual examination. I'm going to start with your head, and because I'm going to do that, I'm going to put some gloves on. They're clean. And before I even touch, I'm going to look to see if there's any deformities, any trauma to your head. I don't see anything. Since you don't have a lot of hair, I'm going to palpate. No depressions, no fractures, so that's done. And the next thing I'll do is take a look going down the face. I'm going to go ahead to your ears. That's the next easiest thing. And I'm looking at your ears, putting your ear back and clear. I'm looking at your eardrum. It's opaque. I don't see a lot of wax buildup. On both sides. Okay, no trauma, no blood, no weeping, no leakage. So that's done. The next thing we're going to do, my cameraman may have to move around a little bit. I'm going to look at your eyes. Just look straight at my nose. I'm looking for perla. Pupils the equal round reactive and light with accommodation. Okay, that's good. And now just follow my finger. Okay, that's good. I'm going to feel the facial bones. No fractures, no depressions, that's all intact. Now I'm going to check his oral mucosa. Say, open your mouth, stick your tongue out, say ah. All right, it's pink, it's moist, all your teeth are there, that's intact. Now I'm going to look at your neck. No trauma, no JVD, trick is midline, and that's all intact. So now that's done. So now we'll go to your extremities. So if you would, shrug your shoulders and don't let me push them down. Okay, that's intact, so can you hold your arms straight out? Try to push them down. All right, now you try to push my hands down. Okay, good. Grab both my fingers and squeeze as hard as you can. All right, so now I'm gonna check pulses. I'm checking the skin color, temperature. All right, all that's intact. Now if you press both fingers together in front of you. All right, that's good. Now let me see your hands. I'm gonna check CRT. That's 3 to 4 seconds. All right, that's good. So now I'm moving down to your legs. So if your patient normally would be disrobed, but we'll pretend like he is, I'm gonna check his popliteal pulses. Those are intact. And also his pulses in his feet. Those are intact. And now if you stick your legs straight out and flex your foot down and forward, checking with DVT with dorsal reflection, and also your right leg, Same way? Okay, good. So now, we're gonna come up to the chest. And what I can do, I'm gonna listen to his heart tones in 4 places. And we're gonna do it skin to skin. So first, for his apex, listen for S1 and S2, any murmurs or thrills. And then pulmonic. All right, and then we'll have to lift his shirt up into his Erb's point. And then the 4th intercostal space. And the final set of heart tones. Okay, now I'm gonna listen to his breathing. Just breathe normal for me. Right upper quadrant, or right upper lobe, left upper lobe, right middle lobe, left middle lobe, and the right lower lobe. There is no left lower lobe. All right, keep breathing normally. Listen to him on his back. Just deep breath in and out, just normally. Another breath in and out. Okay, and at this point, we'll go on to the abdominal assessment. All right, so we're going to continue on our assessment. We've changed settings, as you can see. Mr. Ojeda is still our patient. My hands have still been washed. He still has no pain. And now we're going to do the abdominal assessment. First thing we have to do is expose the abdomen so we can see it. And before you do anything to the abdomen, what I'm going to do is look to see if I see any trauma. I don't see any trauma, nothing abnormal as far as the assessment visually. I'm going to have him lean his head forward like a crunch to make sure I don't see any hernia in the abdominal area, which I don't, and he has no pain. Then I'm going to listen to all 4 quadrants first before I do any palpation. The diaphragm, I'm going to listen to find out if his bowel sounds are hypo, normal, or hyperactive. Okay, auscultation is complete, and what I'm going to do now, I'm going to go back and I can also palpate the chest and what I'm with the abdomen. So what I'm doing with the chest is feeling for his collarbone, all the way down his chest. Make sure his ribs are intact, rib cage is intact, no pain, no deformities, no flail chest. Same thing with the abdomen. Palpate all 4 quadrants, no pain, and that's the end of our assessment. So, as a review, we've done a head to toe. We made sure our patient's vital sounds were normal. He had no pain. We went from his head, we checked his scalp, we checked his face, eyes, ears, nose, mouth, neck. We checked both extremities for good pulses, motor sensation, cap refill, upper and lower. We listened to his heart tones in 4 areas. We listened to his lung sounds front and back, and we did an inspection, palpation, and auscultation of his chest and his belly. Thank you very much.